Tomorrow is St. Patty's Day, and you know that we're already going to go into our spring equinox, and Ramadan has started. We're in the middle of Lent, and we're also going to be coming up on Passover. So this is a time of healing. And what I'd like to start our group with today is really a loving kindness meditation, because truly our world needs healing. And we in our group truly believe it and walk that talk. So if you want to, you can lower your gaze or you can close your eyes. And I want you to think of, in your mind's eye, someone you love very, very much. Hold them in your mind's eye. It can be a pet, it can be a person, they can be alive or they have gone on. But I want you to hold them in your mind's eye and say, may you be healthy. May you be happy. May you be safe. May you be at peace. And because we truly practice what we preach, we cannot care for others unless we care for ourselves. So may I be happy. May I be healthy. May I be safe. May I be at peace. And let's hold our whole world in this, saying our universal you, every living thing. May you be healthy. May you be happy. May you be safe. May you be at peace. And when you're ready, and only when you're ready, come back to this wonderful present moment and presentation.
Thank you, Miss Patty, for that welcome and that beginning to this presentation. And I just want to introduce our speaker, Bill Reddy. And I know his name from Life with Cancer here in the Inova Health System in Fairfax, Virginia. And he's going to present to us an introduction to traditional Chinese medicine and acupuncture. And I just want to give a little bit of background. He's done many things with acupuncture and Chinese medicine. He served on the board of directors. He served on the board of directors for the Integrative Health Policy Consortium. He was the former president of the Acupuncture Society of Virginia, former director of American Association of Acupuncture and Oriental Medicine. He's authored 200 publications in fields of medicine and aerospace engineering, and was the editor and contributor of a book entitled The Scientific Basis of Integrative Medicine, which I hope that's where our culture of medicine is heading full force. Bill is an avid practitioner of Tai Chi, Qigong, and is a board-certified licensed acupuncturist practicing in Virginia, here in Northern Virginia. And so I introduce you, Bill Reddy, and we'll start learning about traditional medicine and acupuncture. And I thank you for being willing to present to our group today. And I know we'll all enjoy it, Bill. I thank you.
Well,
So
thanks so
you're
much
in charge.
Okay. Well, yeah, I'd like to thank Julie and Carol and John and Jennifer and Lauren and Patty, the people who are in the background that make this thing happen, and of course the Watson Caring Science Institute, just for having me and to share some of the knowledge. It's Chinese medicine is unusual, and it's very foreign. It's odd to believe that you could stick a needle between someone's toes and their migraine vanishes. But in fact, over 30 centuries, they figured out how to do that. And I was lucky enough to study under some amazing people to learn this healing technique. And since some of you, or maybe the majority of you, are holistic nurses, the questions I would ask is, well, what are the background and training of acupuncturists in the US? And what are the conditions that acupuncture can treat? and what's an appropriate referral. And finally, what are the mechanisms of action? Because we are Americans and we always have to ask, well, why? And I have such a short time with you. I have a plug and play presentation that I typically give on traditional Chinese medicine, but I wanted to really focus on a part that would be more interesting to you. So I'm going to do that, and then come back to some of the boring stuff about how many how many schools there are, and some of those things. So I'm going to share my screen, and we'll get started. Okay, so I assume everyone can see that. So normally I go right into the history and all that, but I'm going to talk a little bit about the diagnosis and treatment, and then, like I said, talk about the boring stuff, talk a little bit about some of the frequently asked questions. So questions people typically ask: what does it feel like? Does it hurt? What conditions does it treat? What's a typical treatment look like? Is it covered by insurance? Huge one. What are the needles made out of? Is there a license required to practice? Some of the tools and techniques. So I wanted to take a big picture look, and really traditional Chinese medicine, as defined by NIH and also the World Health Organization, is considered a traditional medicine. And it's a whole system of medicine where it's not just acupuncture and moxibustion over here, and moxibustion is the burning of a particular herb called Artemisia vulgaris, or mugwort. And then you have exercise, and exercise falls into two categories, both internal and external. And external exercise would just be like taking an aerobics class. But internal also breaks down into two, which is Tai Chi, which is relatively new. Tai Chi actually is only a couple hundred years old. Qigong, on the other hand, goes back more than 80 centuries. And so Qigong, the word Qi is energy, and Gong, like you hear Americans say Kung Fu, but in Chinese, it's actually Gong Fu. And so Gong means effort, and Fu means skill. So you get skilled with lots of effort. So Qi Gong means energy, effort, or energy work. And so Qigong does have a medical aspect of it, similar to Reiki, where practitioners will send energy into patients to heal them. Qigong is also a healing practice for your own body. And interestingly, both Tai Chi and Qigong will increase SOD, which is superoxide dismutase. That's the anti-aging enzyme. So there's some very interesting studies on that. And finally, there's herbology, which is Chinese pharmacology. And in this discussion, it would be another 45 minutes just to talk about herbal medicine. So I'm really not going to go there, but I'm going to at least try to cover some of the common things related to acupuncture. So if you look at Chinese versus Western medicine, really it comes down to terminology. And the reason why I bring this up is that back thousands of years ago, they didn't have a concept of microorganisms, but they were just as smart as we are today. They just used different terminology to describe the etiology and pathogenesis of disease. So there's 5-element diagnosis system, which is wood, fire, earth, metal, and water. And that's very similar to the 4 humors in kind of ancient Western medicine, where you've got different types of bile, and you also have the dry and the wet and the hot and the cold. What I practice is called the 8 principles, which is traditional Chinese medicine. And the 8 principles are 4 diametrically opposed concepts of yin and yang, deficiency and excess, cold and heat, and internal and external. And these 8 principles are used to diagnose everything from chronic migraines to Parkinson's disease. So I'm going to throw out a couple diagnostic examples just so that you guys can have a better idea of the lens through which acupuncturists look. And I'll take a bladder infection, for instance. So in Chinese medicine, that's considered damp heat of the bladder. And dampness in Chinese medicine has to do with the sense of heaviness of your limbs, feeling fatigued. And heat can not only be fever, but it can also present by the burning sensation when you urinate. And so, what would you do in a bladder infection? You would give them herbs that clear the heat and resolve the damp. And these damp heat herbs, if you look them up, they have antibiotic characteristics. So there's nothing really magical. Again, it's just a terminology difference, but they're still treating the same thing and using herbs to resolve it. With hypertension, however, it's a little bit different, and that there's a number of diagnoses for hypertension. For instance, there's liver yang rising, and the liver is involved with the free flow of qi in our bodies. And when this heat or warmth rises up, then the liver qi can get stagnated, and then you'll have things like vertex headaches, dizziness, irritability, a flushed face, blurred vision, rapid pulse, and all of these are obviously associated with hypertension. There's also a kidney yin deficiency, where again, the yin is kind of the cooling aspect. So when you have a deficiency of it, you have this heat that occurs. There's also a phlegm dampness. There's a spleen qi deficiency. Now, I'm not going to go into great detail on each one just because we have such a short time together. But anemia, for instance, is something that is considered a heart blood deficiency. And so if you think about it, lack of red blood cells, and here in Chinese medicine, they talk about a blood deficiency. And again, they'll look at it as a pale complexion, dizziness, weakness, fatigue, all of the common symptoms, palpitations, insomnia, associated with it. But we also throw in a tongue diagnosis because both your tongue and your lips will look pale. And the pulses change as well. And we also will differentially diagnose the spleen qi deficiency or a liver blood deficiency. And again, the liver is in charge of having the proper blood circulation throughout your body. If you take something like, let's say, flu, for instance, the flu is broken down into both a wind cold and a wind heat. So again, they didn't have the concept of microorganisms back then. So they called it xie qi, which meant an evil qi that would enter your body through your mouth or nose, and it would cause these symptoms to develop. And if you had a wind heat condition, the heat would be being feverish, having a sore throat and a cough, whereas a wind cold would be more thin, runny nose, body aches, headache, and kind of a clear mucus, whereas the wind heat has more of a yellow or green kind of look to it. And so the herbs vary based on the diagnosis. And there's also acupoints on the body that help clear the heat and resolve the damp. So if I were in a live situation, I would pull someone from the crowd and I would take a look at their tongue and talk about what their symptoms are. But online, it's a little bit more difficult for you to throw your tongue out to the camera. But the person to the left has a long-standing yin deficiency, or the Chinese say in. They don't use the Y sound to say in deficiency. And you'll notice that since in has to do with fluid, having a fluid deficiency means dryness. And you'll notice that if there's mud out and it dries, it forms cracks. To the right is a person that has a wind heat condition where there's some dryness and heat. And so there's a yellow coating on the tongue versus more of a light white coating on the tongue. We also have pulse diagnosis that we use, And there are three locations of radial pulse, and Chun, Guan, and Chi, and each one corresponds to a different organ in our bodies. And so you can see that the left hand has heart, liver, and kidney, and the right hand has lung, spleen, and kidney. And there are three levels of pulse: superficial, kind of mid-level, and then deep. And there are 34 qualities of pulse, such as string, taut, or thready. And different books have slightly different numbers. Some say 32, some say 28. In my training, there were 34 qualities. So just like with drugs, the acupoints also have indications. And so this point here, large intestine 11, is defined as midway between the lateral epicondyle of the humerus bone and the radial aspect of the biceps brachii tendon in the antecubital crease. So you would feel for those two landmarks, and midway between them, you'll find large intestine 11. But an easier way is when you bend the elbow, pretty much just past the crease is where the acupoint is. And so that's one way that we find it. So as you can see, things like swelling, pain in the knee, impairment of the shoulder, headache, dizziness, swelling, pain of the eye, all of these things can be treated. And then the Chinese medical function is that it clears heat and it cools blood. And the Chu Qi, which is the name of it, has to do with clearing heat. So the name of the acupoints have a lot to do with what they do. But you notice that the location has very little to do with what it's things that it treats, like knee pain, for instance, or pain in the eye, for instance. And if you go one chun or one proportional unit of measure down from that to large intestine 10, it's a completely different set of symptoms. So it's odd. It doesn't make sense. But that's what 30 centuries will go for you. And I thought this was colorful. And just, demonstrates just the reality of that. And, the amount of studies done, which I'll talk a little bit further about, is really, it would just make your eyes bleed. We are the most studied form of complementary and integrative health in the US. And they're always telling us, well, we need more studies, we need more studies, even though there's 30,000 studies at NIH. And if you look at healthcare interventions at hospitals, and you look at the quality of randomized controlled trials, you can see that roughly 12% have high levels, which means 88% does not. So I will cover what the practice is in the US, number of years, all that stuff. So in Chinese medicine, there's typically 3 years of didactic study. There's a year of internship, and then there's 2 years for herbology or Chinese pharmacology. And there's also an internship associated with that. You can do the didactic while you're doing the internship at the same time if you don't want to have much of a life. The clinical requirements will go in the next. So yeah, I moved things around a little bit. So clinical requirements are 500 hours, and I'll come back to that. So again, people ask what it treats. This came from the NIH World Health Organization consensus statement. This is 40 years old. So they only had, I can't recall the exact number, something like 42 conditions. Now they have the acupuncture research, acupuncture, it's not a research project, there's another term for it, but they have more than 160 conditions. And that was done in Australia. Oh, the Acupuncture Evidence Project. So anyway, you can see that internal hypoglycemia, high blood pressure, and I'll say that It depends on the type of high blood pressure that you have. If you have a lot of atherosclerosis that's causing that, then acupuncture is not going to be roto-rooter for your arteries. But if it's more renin-angiotensin kind of problem with hypertension, then that's something that we can actually change those chemicals in your body and reduce blood pressure. You can see that we treat both diarrhea and constipation. And the interesting part is we use the same acupuncture point, which is on either side of the belly button. And so with diarrhea, as you know, it means that you've got your motility of your large intestine is too fast. And with constipation, it's too slow. So these acupoints, if it's too slow, it speeds it up. And if it's too fast, it slows it down. And in the studies where people had a perfect motility and you needled those acupuncture points, nothing happened, because acupuncture can only bring balance in. We can't throw people out of balance with acupuncture. Deafness, and this is more on the term of not age-related deafness, but more neurological type deafness. And I recently had a woman who had sudden sensory neural hearing loss, and within 6 treatments, her hearing was restored. And they were all setting her up for hearing aids and all these things. And I said, well, just give me a couple weeks. If we don't see substantial change, then we can always go a different route. And what's interesting is last night, I got a call from a friend of mine who said that there was someone who had severe tinnitus, and it came on in November. And I said, well, it's a number of things. It could be an acoustic neuroma if it came on suddenly. It could be an ototoxic drug. So, for instance, if she had a dental procedure and had antibiotics, that can cause tinnitus, as well as long-term NSAID use can also trigger tinnitus. And just for you guys, if you do have a tinnitus patient, that ginkgo biloba, an extract called EGB761, is actually quite amazing. Chinese medicine, we have a 20% response rate with tinnitus. So 1 out of 5 patients get better. So if someone comes in and tells me they have tinnitus, I'm not exactly thrilled. And again, you can see musculoskeletal. A lot of folks know that there's a number of things that we treat from sciatica. And again, if there's a disc herniation and stepping on the nerve and people are having pain 24/7, all the needles in the world aren't going to just suddenly make that disc jump back into place. So if it's a structural problem, it's something that's difficult to treat. But if it's something more like piriformis syndrome or something else that's driving the problem, inflammation, so if you've got foraminal stenosis, that's something that acupuncture can ease, as long as it's not calcifications like spinal stenosis. And I work a lot with people with anxiety and depression, stress and insomnia. That's something that acupuncture can treat. We can change people's neurotransmitters. So if someone is low in serotonin, we can raise that. And also infertility. I don't want to brag, but I've gotten a lot of women pregnant at my clinic. Don't tell their husbands. And so with infertility, it's pretty amazing. We can increase the thickness of the endometrium. We can, if the ova is small, we can change the diameter of the ova. If someone has FSH that's off the charts, we can actually drop FSH. So there's a number of things that acupuncture can do alone without herbs to get people pregnant. Also with men, that if they have a low sperm count, if they have motility or morphology problems, there's herbal medicine and some acupuncture points that can help with that as well. And then infections, bronchitis, hepatitis, dermatological conditions as well. Herpes or herpes zoster, for instance, is a patient I had recently, and there's a number of techniques that we can use to help resolve that. How it works, I don't understand, because it is, you've got a virus in those nerve pathways. How needles can make that go away is beyond me. I don't know, but it works. Okay, so what can't acupuncture treat? Again, things like HIV, AIDS, you're pretty well SOL. Even though I did work at the Shark Cancer Center, my primary focus was on the side effects of cancer treatment. So both chemo, radiation, and hormonal therapies. So I would treat fatigue and peripheral neuropathy and nausea and vomiting and things of that nature. And so things like scoliosis, I do know an acupuncturist in Chicago who says that he can resolve scoliosis, and that's by needling the tight paraspinal muscles to release them and have it align the spine. But I haven't been able to find a ton of randomized controlled trials that support his claim. Again, as I said, disc herniations, spinal stenosis, deviated septum, structural problem. Kidney stones, we can actually reduce the renal colic associated with kidney stones, but we can't, with acupuncture alone, you're screwed. However, there's herbal medicine that can completely dissolve kidney stones and allow you to pass them. And I should know because I have a history of kidney stones and I've used herbal medicine effectively to resolve them. So a lot of folks ask, well, what does it feel like? Does it hurt? And the needles are 4 times the diameter of a human hair. So they're quite small, about a cat's whisker. And they're flexible. And if you've had a mosquito bite, usually a mosquito bite hurts more than an acupuncture needle. However, it depends on where you're getting needled. So if you remember the homunculus in your training, which is the side view of the brain showing the density of the pain receptors in our bodies, you'll see that there's big lips and big hands. And you got these little arms and these little legs, these big feet. And so if I were to take a needle and put it anywhere on the palm of your hand, it would sting like a bee. And that's true if I were to put a needle on your lip, for instance. Whereas when I put a needle on someone's back or legs, I'm usually going between the pain receptors, and all you feel is this tap, but you don't actually feel the penetration of the skin. So, uh, so it's the typical acupuncture treatment as depicted in Hollywood. Some people may recognize this from the Matrix movie, but you'll notice that throughout there seems to be this common misconception that we use a ton of needles in acupuncture, and that's untrue. I average maybe 6 needles per patient, and these people can have migraines and menstrual problems and bladder issues and shoulder pain, and again, 6 to 8 needles. So it's not a ton. The most needles I've ever used was 34, and it was for a woman who had spinal muscular atrophy, and I was running needles down her spine to try to affect her condition. And I was an intern at the time, so I had zip for experience, and the outcome wasn't positive. So I hang my head in shame. So people ask, well, how long does it take? And different practitioners have different numbers. For me, I spend 90 minutes with the patient for initial evaluation and treatment. Afterwards, I can have people in and out within an hour, and the needles are retained or left in the body for 20 to 30 minutes. People may ask, well, wait a second, what about dry needling? What's the difference between dry needling and acupuncture? And the answer is, dry needling is acupuncture. It's just a subset of it that's called the turtle probes the sand. And it's where you don't use acupoints, so you don't have to be trained in that. You just need to know regional anatomy, and that at the belly of the muscle is where the neuromuscular junction is. And if you needle that and finally touch that point, you get this twitch or fasciculation of the muscle, and it releases. So if there's a muscle in spasm, you use the needle as a tool to release it. And that's what the physical therapists and others are trained. So insurance coverage, it's kind of up and down throughout the nation. This is kind of an older, oh, that's right, it's a slightly newer study. But it shows that the coverage did increase. So it went from 40 to 50%. So a 10% increase in the past decade. And I should also mention that I did work with the NCCOM, which is the National Certification Commission for Acupuncture and Oriental Medicine, and we did go to CMS about 4 years ago with the stack of randomized controlled trials for chronic low back pain, and we were able to get low back pain covered by Medicare. The only problem is that we are not providers within the Medicare system, and so we have to have a physician supervisor that will get paid, and then they have to turn and pay us. So except in hospital systems, we currently can't really treat Medicare patients at this time, which is 54 million Americans. We are working on a bill that is in Congress that will change the Social Security Act, which will include us as providers. And then we can do that more freely. So the needles are stainless steel. They're used once and discarded. The Red Cross has said, oh, well, if you've had acupuncture or had tattoos, there's a possibility of you getting hepatitis. And we educate them that no, there's 0% chance of getting hepatitis from an acupuncture needle because they're not cleaned. They're used once in a way. However, every time there's a new person in Red Cross, then that kind of gets reinstated, and then our national organizations have to tap them on the shoulder and say, no. But if you do have tattoos and they don't clean their needles properly, absolutely you can get hepatitis. And so some of the boring stuff, if you practice in Virginia, you need to graduate from an accredited institution. You have to have a national board certification, which is an 8-hour exam. You have to have a certain number of credits in biological or biomedicine, and about 500 hours of internship. And we need to have about 60 hours of continuing education to maintain our licensure. Currently, 47 states have independent practice statutes. The ones that do not are South Dakota, Oklahoma, and Alabama, and those are states that people don't want to live in, and that's the reason why there's no practice. Now, so when I was the director of the national, like the AMA of acupuncture, we had 38 states. I'd have to revisit, but there were a number of states that did not have them, and we would have to visit the states with the acupuncturists there and say, well, let's talk to your legislators to see about getting that reformed. And so, like for instance, South Dakota at this time has about 5 acupuncturists working there. True, they're considered practicing medicine without a license, but they don't want to get the statute because then they have to pay for malpractice insurance, they have to pay for CEUs, they have to pay for their licensure and all of these things. So until they get excited about it, we can't really get licensure in those states. So currently there's about 65 schools across the nation that offer acupuncture. There's about 8,000 students that are enrolled. You can see that I did have a map that laid out our distribution, but obviously because there's a ton of schools in California, it's a large state. There's about 18,000 of us that practice in California. There are a number of other states, like for instance, Florida and New York have more than 1,000 practitioners because people study there and then they graduate and they hang their shingle. Virginia only has 350, whereas Maryland has close to 1,000 because there were more schools in Maryland. Now there's 2 or 3 accredited schools in Virginia. So back about 20 years ago, there's a nationwide clinical survey, and you can see of acupuncture patients, 91% reported disappearance or improvement. They see their MDs less, they have fewer prescriptions, they have less surgical procedures. So very positive outcomes. There's also a group called ASH, which is the, what's that stand for? The American, dang, that's a problem when you use acronyms too much and you forget what they stand for. So anyway, they're a subsidiary of other insurance companies like Blue Cross Blue Shield and Cigna that want to offer alternative or integrative health. And they did a study, and acupuncture was off the charts as far as the response. For instance, 98% of the patients said they would refer their acupuncturist to their friend or colleague. So we had some really good numbers there. So how does it work? There's more than an hour on each particular theory. If you look at Albert Einstein, he was looking for that grand unified theory his whole life. He was trying to figure out the connection between the very, very small, which is particle physics, and the very, very large, which is cosmology and the universe. And he wasn't able to do it. And the same thing is true for scientists trying to figure out some of the mechanisms of acupuncture, is that, like, for instance, pain would definitely be under the anti-inflammatory and endorphin concepts. However, what about enlarging that ova or adjusting the FSH? That doesn't really, but with the circulatory theory, that is something that talks about adjusting both endocrine, exocrine organs and what they produce. Gate theory has to do with A, B, and C fibers and how they transmit. And so they believe that acupuncture blocks that communication channel to the brain, so that the pain is reduced. There's also an endogenous opioids that are produced in our brain, and that acupuncture triggers that, and that absolutely has a pain reducing effect. But that's short term because they're opioids. But when pitting acupuncture against opioids in an ER or ED environment, what they found was, so they had IV morphine versus acupuncture, and the IV morphine was 74% effective and acupuncture was 91% effective. So we really should be used in ERs across the nation, but again, it's a tough nut to crack. And eventually, currently the top 10 hospital systems in the country do offer acupuncture. So you look at Harvard, Johns Hopkins, Cleveland Clinic, all of those offer it. And some of the best cancer centers in the country, like MD Anderson, also have acupuncturists integrated in their system. And so again, I mentioned to you that there's about 30,000 studies pertaining to acupuncture, about 40,000 studies pertaining to traditional Chinese medicine and some of the techniques associated with that. So I have a colleague at Harvard. He does MRI studies. And so with a patient that has carpal tunnel syndrome, if you look at the difference in the highlights, what you're seeing before and after acupuncture is a change in the activity of the brain that perceives this pain. And for those of you who have a neuro background, it talks about having the needle stimulation, how that stimulation goes through the thalamus and the hypothalamus, and the different pathways that it talks to. This is above my pay grade. If you ask me to explain it, I'll tell you to talk to a neurologist. Here's something really cool, is this person had some pretty serious neck pain. And so they did a thermographic study with an infrared camera, and you can see pretty clearly there's quite a bit of inflammation. And within 30 minutes of the treatment, it calmed down. And the interesting part is bladder 40, the acupoint used, is on the popliteal. It's behind the knee. So they're needling that point. And the pathway of energy that runs through your neck is the bladder meridian. And that's the reason why we needle the bladder channel to clear that pathway. Oh, here we go. So bladder 40 is located right here. There's 361 acupuncture points on the body. They're bilaterally symmetric, so that means that we have a choice of about 800 points to use. And there are rules about just treating the right side or just treating the left side, depending on if something is acute or chronic. It's quite a complicated system in medicine, is the reason why it takes so long to study it. And each point has its own indications and also functions related to Chinese medicine. There are also 40 what are called extra points, and these 40 points do not lie on these pathways of energy, but do have therapeutic value. And so those are named with their Chinese names instead of this. So for instance, a point you guys have probably heard of is large intestine 4, which is located right here. And it's called He Gu. And that point has a number of uses. And it's also known for acupressure, to press. And the truth of the matter is, when I have a frontal headache, I can press this point a lot, and I don't really get much of a result. But when I put a needle in, I do. And what's interesting is that acupuncturists aren't trained in acupressure. It really is a separate technique, and people have to know how to use it properly to do it well, I guess, to get a good response rate. The end stones, before there were needles, they actually used these blunted instruments to stimulate acupuncture points. Gua Sa is another technique that we use, which is a scraping technique. So gua means scrape and sa means red. So you scrape red. There was a New York couple whose son went to school, and when he was hanging upside down on the bars, they saw these marks on his back and thought that he was being abused, and dragged his parents into the local police station. And he had a cold, and so they were scraping his back for the cold. And once it was explained, luckily there's a Chinese police officer that said, whoa, 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 this is not abuse. This is very commonly done, and we'll use a coin or a spoon or a horn to do this. And interestingly enough, there's certain immunoglobulins that are triggered, and certain white blood cells that are triggered by doing this technique. As I mentioned before, moxibustion is the burning of herb. You see in some movies where they have herbs at the ends of the needles burning. And so this person has lateral epicondylitis or tennis elbow. And the Chinese say that there's a stagnation of energy and cold in that joint. And by warming the needles, you're able to warm the joint and resolve the problem. Or you can do it in a stick form where you have something that looks like a big old stogie, and you warm the area. Also, for cold conditions like rheumatoid arthritis, you can warm the joints, and you can get a tremendous response. And there's actually blood markers, erythrocyte sedimentation rate changes, and other things when you use moxa. So there's I don't know, 200 to 400 studies on moxa alone at NIH. There's also cupping, and that tended to be popularized by Michael Phelps and some others. And I find it interesting that these talking heads will say, "Oh, well, there's no scientific support that cupping works." Yeah, you just have these elite athletes using it. It's kind of silly, but yes, there are, again, about 200 studies on cupping at NIH, and I wrote an article right after when it was in the news about Michael Phelps and others having cupping marks. It was very short and very succinct, and no one would publish it. Not the New York Times, not the Washington Post, not the Kansas City Gazette. And you may say, well, wait, why? Why aren't they doing that? And the answer is, look who's on their board of directors. And there's pharmaceutical representatives and also people who are paying. So they do not want Americans to know that there's actually scientific support for alternative approaches. And I should also mention that this person here could be suffering from fatigue, and that by putting cups along the bladder channel, the nerves that talk to your liver and your heart and your kidneys, etc., have that pulling sensation and increase blood flow, and therefore electrical conductivity. To your left, this person probably has a frozen shoulder, and so they're looking to release that capsule. Also, you can have moving cupping, and you notice that when massage, you can only push, and cupping, you pull. And so when you pull on connective tissue or fascial planes, that you can release that. And there's a shear effect. So when you have connective tissue, it's stuck together, tissue adhesions, it pulls apart those adhesions and allows greater range of motion. So a single cupping session can change someone's range of motion from, 10, 20, 30 degrees. And physical therapists will think that my patients are doing their exercises regularly when in fact they cheated and got cupping. We also do electroacupuncture, and that's where we connect alligator clips to needles and then shoot either millicurrent or microcurrent, and we use different waveforms. So you can have a square waveform, you can have a sinusoid waveform, you can have dense dispersed where it goes and then it pauses and then it goes and pauses, and we can change both the frequency and the amplitude of the waves. There we go. So I do have some other backup slides, but I just wanted to make sure that we had enough time at the end to answer any questions that you may have. And I see Hillary's front and center, so I'd be happy to answer your question, please.
Well, just a couple of comments and then a question, but I was fortunate enough to work at an integrative functional medicine practice with Dr. Rosemary Rose. You might know that name.
I absolutely know her.
And I was really fortunate enough to work with acupuncture firsthand as a nurse. And I did use the moxa on the needle, around the needles to bring that and the electricity. And I really saw firsthand how much patients responded to acupuncture and how much it helped them. They would come back for it. Some people used it acutely, some people used it for chronic conditions. Interestingly, that led me to going to an acupuncturist, which you also might know, Megan Richard or Reichard. She's with Positively Chiropractic.
In Edmonton, yes.
And so I was going to her, and I had a knee injury. I tore like an ACL, and I went to ortho, and I had an MRI, and they said, yeah, we got to go in there, we got to clean it up, we got to do surgery. And I talked to Megan, and she said, I did something similar, and I can really work with acupuncture on this. And I did, and I avoided surgery on my knee. But yet it didn't occur to me at first, because I thought, oh, I'm going to go with mainstream medicine and have ortho go in there and clean all that up. And because that's what everybody was telling me to do. I think my question to you is, I wish, one, insurance paid for it, because people often aren't going to go to treatments that their insurance isn't going to help them with. And two, where like in our area, I feel like it's you really have to find it on your own. Like even Inova doesn't really have a lot of acupuncture referrals.
Agreed. And so, I worked part-time with Shar, and then part-time at Inova Well, where not only did I treat people who worked at Inova, because there's 18,000 employees, but also with the local community. And then they closed the program, and they said it was purely a business decision, but it was around for 13 years. And once again, the literature demonstrates that if you do not have a physician, how do they call it, champion, then it will go away. And so that's kind of what happened. So that's unfortunate. But the federal insurance has about 24 treatments per year if you're in network, which is pretty good. And also, I know that Fairfax County, with some of the teachers, also have decent rates. Cheryl?
Thank you.
Yes, I want to thank you for a very informative presentation. And also, I put in the chat that highlight that as the the VA healthcare systems evolved. About 10 years ago, they did, through their complementary integrated program, holistic healthcare, they did integrate a program called Whole Health. And one of the programs they offer through Whole Health for the veterans is acupuncture and acupressure. And from the experience that I saw, excuse me, with the veterans, that if there was a lot of success, but there's also a lot of controversy because I would hear these veterans, particularly the younger OEF, OIF, those who fought in the Iraq and Afghanistan, they would talk about how they would go see their psychiatrist, with their mental health diagnosis of PTSD, and they just load them with all these psychotropic drugs and how I need some relief. And then they go to the acupuncturists and they are slowly getting weaned off of their drugs and feel better about themselves. And then the primary care physician would just cut them off because they didn't want to see that. So there's such a big dichotomy in healthcare with the integrated medicine and the traditional medicine that it puts our patients, whether they're veterans, whoever, in a very difficult position. So thank you for doing what you do, and we all on this forum, we are advocates for this work, and we will continue to be advocates because it is much needed. Healthcare, like our leader in this work say, is not healthcare, it's sick care, and that's what we see all the time. And we say, why can people do what they're doing when they know there's alternatives out there to foster healing? But yet, because of in this Western culture, capitalism is all about the dollar, who's getting paid. Pharmaceutical companies are feeding in a lot of money to put people on drugs that they don't need. So there's a lot of things that we have to continue to deal with, but the solution, don't give up, just keep doing it. So thank you so much. And it takes courage to do what you do. So thank you.
Well, I appreciate that. And I just wanted to mention that the VA system, because they don't have the profit, that profit focus, both Tracy Gaudet and Dr. Ben Kligler, that are the leads for Whole Health,
Yes.
we're really pushing that change in paradigm from what's the matter with you to what matters to
What
you.
matters to you. You
It's
got it.
really
Yes.
brilliant. And so I did a congressional briefing with Ben Kligler on this. I worked closely with them and actually wrote an article about Whole Health, actually more than one. So they have 1,200 facilities across the nation. So they actually are the largest healthcare system in the country, treating more than 5 million people per year. And
Exactly.
And they have 91% of their facilities offer some kind of complementary alternative medicine, but it may just be that they offer a yoga class on Sunday or a meditation, or they have an acupuncturist on staff. So it hasn't been codified yet across the nation, but they absolutely want to be the Center for Integrative Health and have that as a model. And
Exactly.
recently, AHRQ wrote a paper that talked about that and said that that AHS that HHS should be talking to the VA and blending some of that in, and I certainly hope they do. Lauren?
I just wanted to make a comment. About 3-4 years ago in our hospital, there were 21, I think it was during COVID, 21 physicians trained in doing acupuncture. And I was talking to one last year who I said, how do you use it in your office? And he goes, oh, not really. He goes, I took it just to see what it was about. And it was a lot of learning and a lot of, he goes, but I don't know really how it could work. And I said, but have you used it and it did work? And he said, the times that I used it, yes, it seemed to work, but I can't explain how. And I asked him to do for Nurses Week last year. So he came and he treated about 10, I think 12 people, 12 nurses with either back pain, or all of them raved about it. They couldn't, they thought it was excellent. And he was at the end of the day was like bewildered of how well it worked. So even though physicians may be more open to trying new things and delving, their brain just doesn't. He said he's the only one. There, none of them really are practicing out of the 21, which is such a shame. But so.
Yeah, the other thing, the main reason why a lot of physicians may learn and then not apply it in practice is because it takes too long. Is that it ties up treatment rooms, and in order to have that high volume to make the money, they find that it doesn't
Pay off.
yeah, it doesn't pay off.
Yeah. Yeah.
Please,
The,
Patty.
yeah, the good news with our young OIF and OEF, which Cheryl was talking about, is on active duty, they were exposed to battlefield acupuncture because that was the only place that we could get to in their ear to help manage pain. And so they came to the VA after they got out of service, and they said, I want battlefield acupuncture. And this is at the time when we were having the opioid crisis. And the
Yep.
most wonderful thing was how we changed that purview, having them with battlefield acupuncture. And like you said, Dr. Ben and Tracy mandated that it was, if the hospital, if our VA hospital doesn't order it, have an acupuncturist on board, then our veterans could go on the outside and get it, and we would pay for it. Because it was one of the six, it was one of the 6 on the list. We have list 1 and list 2, and acupuncture and chiropractics were part of list 1, along with massage for head and neck pain too. So, I mean, the emergence of our VA being really the change of paradigm for healthcare is so exciting for them. And like you said, what matters to them, and we want them to have the quality of life for the service that they have given to our country.
Yeah, certainly. And I'd like to call out Dr. Richard Niemsau, who's a colonel, retired, who developed the battlefield acupuncture protocol and really did some wonderful work. And he's also the editor and chief of the AAMA, which is the American Academy of Medical Acupuncture. And they have a journal, and I've written for the journal, and I'm actually serve on the editorial board, which I'm the first non-physician to be on their board, which I appreciate, because a lot of times, if you don't have letters after your name, then you just won't, have it in. I can't see everyone on here, so I just want to make sure that there aren't any more hands up. I know that we're pushing noon, and I certainly, please.
Oh, you're on
sorry.
mute. Carol, you're on mute.
I wanted you to go back to the beginning of your talk, which it just woke me up, Bill, when you said that there was something that had that aided with anti-aging. You were talking about, is it the Tai Chi or Qigong or?
Oh, yes. Yes, that's SOD, which is superoxide dismutase. And I wrote an article about the benefits of Tai Chi in integrative practitioner. But if you also go to my website, you can just do the keyword Tai Chi and you'll find it.
Okay.
But yeah, it's quite interesting. And so as we age, SOD declines, and that's the reason when you look at some of these Qigong masters, they're 75, and so on a cellular level, they really are 50, 55 years old. I mean, I'm eligible for Social Security in a few years, and I don't feel my age.
And the other one was the headache. What's the position for the headache if you have a headache? There's something that you said that's where they put the
large intestine 4. Right
Okay,
there.
yes. So large intestine 4 is located right here. The thing is, that's for frontal headaches. If you have an occipital headache, a parietal headache, a temporal headache, then it's different. I wrote an article about CGRP medications and how you can needle a point gallbladder 20 on the back of the neck that actually triggers the CGRP. It modulates it so that people who have it causes vasoconstriction. And if you look at drugs like migraine strength Excedrin. It has caffeine in it, and caffeine is a vasoconstrictor. So the only difference between the drug and acupuncture is that the drug, once the blood concentration level dives, the migraine will return over time. Whereas acupuncture actually trains the body to maintain that tonus of blood vessels in the cerebral blood vessels, and then the migraines will not only go away but stay away. And I've called my patients 10 years after their last treatment. These are people who've had migraines since they were in their teens, and they're gone. So it's pretty impressive. But again, a lot of people don't know that. A parting message for folks would be that acupuncture stimulates your body to heal itself. And I think that's really important, because when you cut yourself and there's a scab, and then the scab goes away, and you don't know where it is anymore, that's your body healing in action. And what acupuncture does is it just accelerates that. So when you're needling, let's say, a tendonitis of some sort, you actually cause micro trauma in the tendon when you're needling it directly, and that causes your body to heal itself. Mast cells come in and do their thing.
Bill, we had a question in the chat box about treating insomnia.
Oh, certainly. So there's different types of insomnia. You can have people who are having trouble falling asleep and staying asleep, or some people have both. They have trouble falling asleep and staying asleep. So there's a number of pathologies that are behind that. So if you're a middle-aged woman and you find out that you keep on waking up at 3 o'clock in the morning kind of consistently, that's a hormonal issue. If people find that regardless of when they fall asleep, they tend to wake up 2 or 3 hours after they fall asleep, that's usually a sugar handling problem. And I would definitely have them look at how they're handling sugar. And going hypoglycemic during the day makes you kind of nodding out and dizzy and sleepy. But when you're sleeping, your blood sugar level is diving, and your brain is saying, oh, I'm going to coma if this continues. So it says, excuse me, wake up, wake up, wake up. And it wakes you up so that you can eat something. So for those folks who have that condition, just having a few nuts before they go to sleep, a protein that metabolizes slowly, will allow them to sleep through the night. And I wrote an article that's great. It's about the insomniacs, about, I think it's called the Insomniac's Nightmare. And it's about technology and how things like the blue light coming off of our screens will not allow melatonin to be produced in our brains. How Wi-Fi, people have an effect, a biological effect of Wi-Fi in their homes, and a whole host of other things. Charging things close to your head in your bed is a big no-no, but that's something that can be helpful to you.
And I think it was Hillary that brought out a point of incorporating and integrating both healing touch as an energy practitioner and also acupuncture too. So, it's enhancing the health of our patients too.
Oh, certainly. And just to jump forward a little bit, because I didn't know how much time I had, I have a frequency-specific microcurrent device, which is something that's not used primarily by acupuncturists, but this particular model has 99 programs, and it shoots 2 different frequencies into your body and targets tissue. And so you can see here myofascial pain, you've got neck pain, you have emotional things on there as well. It's pretty amazing, and I'm still new to it, but it's quite an impressive product. Are we supposed to stop exactly? I don't know what the rules are here, and I don't want to overshoot our requirements.
Well, if people have questions, I mean, if you have the time, it's fine. If to go over a bit.
Oh,
and
great.
People have been asking you questions, so.
Oh, that's wonderful. I would like to do a few more slides, and then I'd love to entertain any more questions if you guys have it in you. Something that I wanted to share is that there's other things like kinesiotaping that is something that's not taught in traditional Chinese medicine, but again, you've seen it in the Olympics, and it's got some really great effects, both for support of joints and also for lifting of the tissue to increase lymphatic. I just used it on Friday on a patient, so really good stuff. Costs about $1,000 per class to take this, and I guess you get some kind of certification. So I also wanted to mention that acupuncture more and more is being on the hill, and because I work with the Integrative Health Policy Consortium, we have some presence on the hill. So the CDC opioid prescription guideline originally did not include acupuncture. So the draft included acupuncture as being a non-pharmacologic approach to both chronic and acute pain. And then when it came out for real in 2015, 2016, that was stripped from it. And our profession was really horrified because we were really clapping about this being included. Then they redid it in, I think, 2021, and then they did include acupuncture as something that's important to fight the CDC, fight the opioid crisis. And in in Rhode Island, the CMS did a year pilot program where they included acupuncture for people who are suffering from chronic and acute pain, and they found that there's a 61% reduction in ER visits. There's a 27% reduction in overall cost of care, and there is an 87% reduction in opioid use. So that's huge. So the numbers are out there. They know what we can do. And this is not like the top tier 20-year veteran acupuncturist. This is the average acupuncturist on the street that are treating these patients. That's quite impressive. Lauren, did you have a thought or a question?
I did. It is a shame that they're not looking forward, but I think it's the drug farm, companies really holding things down. Dr. Mark Rosenberg at St. Joseph's Health, where I work, was one of the, we were the first hospital, I believe, to put an opioid reduction program into place. And I was part of that. Well, I was hired 2 years prior to that to do just 9 hours. My regular job was patient safety improvement officer at the hospital. And he wanted to incorporate holistic. So I did chronic healing in the ED. And he wasn't, a believer in it until he started looking at the charting and looking at the stats that were going on. And I did heal his neck at one point. And he said, "Oh, it's just from me sitting here." I said, "Well, that's okay. You sit there. You believe it's from resting. I believe it was the healing. So no matter what, you're pain free. So it doesn't matter, who's right." But he really became a proponent of the healing, because I was primarily for the geriatric ED, and they wanted to use less opioids for any kind of pain. And there was a woman with I think she had a broken ankle, actually. She was 80. She refused any pain medication. So they sent me in to see, and her pain went from 10 to 0, and she was amazed. We were even on Channel 7 News, I think they came, and oh my gosh, what's the big paper? Oh my gosh, New York Times, sorry. And he called me down to come and do a demonstration. And he was like hesitant though, like, what if it doesn't work? I said, well, medicine sometimes doesn't work. You give patients pain medication, doesn't work. I'm not afraid that it's not going to work. Let's just try it. And it was like I paid the patient to recover quickly. They couldn't, I didn't, but they were, the reporter and the doctor were like, but I think if it became a little more mainstream, like where doctors could observe, because then they would come to me and say, "Does that work on blood pressure?" I said, "Actually, it does. Can you come with me? I'm having trouble with this patient with hypertension. We're giving him medication, nothing's bringing it down." And I would work on the Ming Ming chakra, and the blood pressure came down. They're like, "How did that work?" And I said, "I really don't know. I just cleaned the energy in one of the chakras." But I think if people just paid attention more to, or exposed to it, especially with scientific minds, they might not It's been my experience that they're not very open until
Certainly,
they see it, until they observe it.
yeah, and that's part of the reason why I'm trying to bridge the gap between the Western medicine and Eastern medicine to try to educate physicians that this isn't just woo-woo and that there is a lot of
Right.
scientific support. And one of the things I wanted to address was the safety of acupuncture. And we're actually about as safe as massage. As far as malpractice suits go, one of the major malpractice suits for acupuncturists is the TDP lamp, which is the far infrared lamp that we use, which can burn patients on certain occasions. And so that can be dangerous. If you don't know what you're doing, and physical therapists doing dry needling have punctured people's lungs and had a pneumothorax due to going a little too deep into the lung apex. Acupuncturists were beat over the head about do not do this, this, and this. And the regional anatomy of every acupoint is studied in great detail. So we know exactly what is beneath the skin that we're needling. So the truth is, if I were to needle a nerve and you would feel a sensation, the shooting sensation when the needle touches the nerve, I could needle it 100 times and you're not going to get nerve damage because it's a solid needle and the nerve has fibers. If I were to do it 1,000 times, there probably would be a chance of having some neurological damage. But when you have a syringe, then that's a tube with a 60-degree angle cut, and that whole edge is a cutting edge. And so when you put that in a person's body, you can sever nerves. And that's a reason why, there can be some problems with either numbness or motor problems. I saw a hand up, so I'd love to answer any question.
Oh, I had my hand up, Bill. I didn't have a question. I just wanted to comment on what Lauren said. And she mentioned something about when will people maybe get on board, but part of which we all are aware of, the issue is that in this Western culture, how we've been socialized and been trained and conditioned in higher education. And until that transition or that evolution or expansion occur, we're going to be in the same position, And I think it helps a lot. I'm always impressed with people, particularly people that are experts in their field, and they're presenting and they're saying, I don't know. See, part of the other issue is that, in researchers, what does the evidence say? But this energy work is so mysterious and so mystical that the human mind and brain doesn't have an answer to it, but people aren't open because that's how we've been taught and socialized. So we remain hopeful, but there's still a lot of work to do. And I wanted to just share this really quote that's powerful. Anybody who's ever heard of spiritual teacher Ernest Holmes, lots of work out there, The Power of the Mind. But when you get into acupuncture, any type of holistic medicine or health, it's empowering, it's liberating, and it gives individual the power to know, hey, I can take responsibility for my own health. And what he says in his quote is that humans will deliver themselves from sickness and trouble in exact proportion to their discovery of themselves and their true relationship to the whole. So that's what has happened. There's a dichotomy exists with how we've been educated and brainwashed and not knowing that we're already whole and the healing, everything that we need to heal ourselves is already within us. And that's what you do through acupuncture or any other healing modality for healing. That's what it takes. But that's a whole shift in a mindset that we've been conditioned to think just one way. But I commend the Asian practices because they seem to get it. We talk about Chinese philosophy of Wu Wei, effortless action. Most of the illnesses that occur with us, it's because there's some imbalance with our energy and there's some resistance with our energy instead of what we've learned in Caritas, equanimity, non-interference, just let it flow through us. So, but this has to be taught and it's not taught. It's not taught. So that's the only comment I want to make. Thank you.
Thank you. And certainly we as Americans are programmed because there are only 2 countries in the whole world that allow direct advertising of pharmaceuticals to the common citizen. Do you know what the other country is?
No, I don't know.
Any guess? It's New Zealand, of all
Oh,
places. And
interesting.
it's a very, very random. But the point is that the US, we consume 70% of the world's drugs and 90+% of the world's opioids. Now you look at the earth, and the US, 350 million people, represent 5% of the earth's population. And yet we use 70%. So either A, we are very sick people, or B, we are really well marketed to. And I think we both know the answer to that. And so it is terribly frustrating, and especially when we have solutions that are non-pharmacologic, but it's being suppressed. If for a while, NIH said that, well, there's all this science to support acupuncture, but it could be placebo. And that was a political thing that got pressure from above to put in there. And I pushed back, and I worked with the director there to get that removed, along with the national organization. I just didn't, I didn't push myself in there by myself. I representation. I had a title, so it made it a little more easy to do that. Hillary?
I just wanted to also add just a little bit to that conversation, Cheryl. I felt, as when I worked in integrative functional medicine practice, to get back to who really will search that out, are people whose medical conditions are not being answered in mainstream medicine. And so often it was the people who had autoimmune issues or other issues that, they had gone from one doctor to another doctor to another doctor. And it's sort of going back to that cartoon that Bill had up earlier. Like, I went to everybody and nobody can figure anything out. So here I am at integrative and functional medicine. So you can help me. But often it was that root cause analysis that really is going into why those patients are having it. But it was really those patients who are being their strongest advocates and really searching and really digging. So again, I think you're right. We're not being educated, and the people that are really figuring that out are the people who are really trying to figure out what's wrong with them. And they're also willing to spend the money, or they have the money and they have the resources. I should say that as well. I don't want to, I know there's a lot of people out there who can't afford to go to an integrative functional medicine practice and pay out of pocket. So just wanted to add that to the conversation. But I think that patients they want to find the answers.
So a quick question: How many of you do practice some kind of healing touch? Is it a fairly large percentage? Okay, or Reiki?
Oh,
or Qigong?
I'm pranic healing. That's part of Qigong.
Awesome. So interestingly, they have done studies, and what they did is that they found that when you tear a muscle or a tendon or a ligament, or you break when you heal, these electrons are jumping back and forth, and whenever you have electrons moving, you have a magnetic field, electromagnetic field that's produced. What they found is that in the electromagnetic spectrum, from ULF, ultra low frequency, all the way up to VH, a very high frequency, there's a very narrow window, just like light is a very narrow window in that. There's a frequency of healing in the human body. And when they measured that of Qigong master or people that were doing Reiki, they found that was the exact frequency of healing coming off of their palms.
Wow.
So how cool is that? So it demonstrates that we really are accelerating healing. There's an incredible video, which you may be able to search on the internet. I saw when I was in school 25 years ago, where they showed two Qigong masters standing on either side of a patient that had a sizable tumor, that they were real-time ultrasound. And within 2.5 minutes, that golf ball size mass vanished. Now that is violating physics. And from someone like me that has a strong science background, it doesn't make sense, but it demonstrates that we really aren't matter per se, that we really are space, and that when you look at quantum physics, that we are a vibration, and it's only until you look at something that that waveform collapses into something that we can feel.
I just want to acknowledge Patty O'Rourke, because I had two incidents with her. I had 3 growths on my thyroid, which the doctor was, the biopsy showed non-specific cells, and they were pushing me to get surgery to have my whole thyroid out, and I was really resistant. I didn't want to do that. Pat, I'm in New Jersey. Patty, where are you?
In North Carolina.
North Carolina. She said, I'm going to do a healing for you. And I really had no symptoms other than they saw it on a PET scan. And when I bend my neck, I could feel pressure here. But other than that, nothing. So she was healing me. I had gone to the ladies' room, but I looked down and I felt nothing there. You know, like I didn't feel any pressure. When I went back to my doctor, he was pushing for surgery again. And I said, I want an ultrasound again, just before I had surgery. And he couldn't believe it, but it was smaller and I didn't need surgery wasn't recommended anymore.
Nice. Yeah, I had a similar situation where I was working with a woman who had fibroids, and I treated her just with acupuncture alone. If it's smaller than 2 centimeters, you can do acupuncture alone. Otherwise, herbal medicine is required. And I worked with her for about 3 months, and then I had her retested, and the fibroids were gone. And of course, within about 4 weeks, her symptoms of spotting between periods was gone. And she worked at the place that does the ultrasound, and they said, oh, they must have mixed it up, and that the images were from another person. Come on. It's so ridiculous how MDs will when they see the results. And Hillary, before I get to you, I just wanted to share that I was hanging out with a physician who worked at a hospital, and he did acupuncture, and they had cancer patients who had leukopenia. And so he did some points and increased white blood cell production, and then they retested them. And he said to the oncologist, okay, now that you've seen the clinical side of it, send more patients my way. And the response was, no, talk to the hand. And he said, wait, what? Why? And he said, well, because we don't understand how it works. So, and so even when they have documented evidence in front of them, they still refuse to believe. And I get it. It's their paradigm. I got accepted at Johns Hopkins. I was going to be a neurologist. And I realized that to see patients all day long and write prescriptions and push them out the door, it just isn't healing. And so, yes, I make less money, but I look forward to work every day. And if I had to rewind time, I would do the exact same thing. And again, as an aerospace engineer, I made decent money. I put satellites up in space. I flight tested helicopters for a while. It was fun, but I just didn't feel satisfied. So, you got to find what warms your heart and do that. And, and then you don't work another day in your life.
Exactly.
So, yeah, there's another question. Sorry, since I can't see everyone, I don't know who's got their hands up.
I don't see another. There any more questions? Anybody want to make a comment before we come to a close? Oh, Robin, you got to get off mute. Yeah.
Yeah. Hi there. I'll definitely make a comment. I mean, this has been wonderful. It's very informative. I'm actually a patient of Dr. Tom Roselle. I don't know if you're familiar with him or not. Healing Center, yes. And receiving acupuncture through Kaiser. I'm a Kaiser patient, and they do approve 20 some visits for acupuncture, and mine was for low back pain. And of course, it's been wonderful, the combination of the two. So I still, I'm seeing my regular doctor, but this was enhancement for me, just to add on to I was having problems with inflammation, and I had a reaction to the COVID shot. So anyway, it's just enhanced. But the comment, it's all about money from the pharmaceutical companies. I mean, that's the sad thing is, so people like us, you have to promote and you have to share. I mean, for me, I've sent several patients to their center just because of the result of what's happened to me, the improvement that I saw within 3 visits, just going, for the acupuncture and for the chiropractor. So it's significant, but it's just making people aware and then bringing it to the forefront. Thank you for what you do.
Oh, it's my pleasure. Thank you, Robin. And I did briefly want to just mention that there's a number of places that this is a summary from a paper that I'm writing with 6 other authors that eventually will be published. And so it's 22 pages long, covers everything about acupuncture practice in the 21st century, and has about 150 references. But you can see that, like, the clinical practice guideline for allergic rhinitis, I worked with 22 physicians and we created this. You've got the Surgeon General's report, which included acupuncture for dealing with addiction. There's the 21st Century Cures Act. You've got the FDA blueprint that has acupuncture listed in it. The Veterans Whole Health we discussed. HHS report on pain management best practices included acupuncture as a viable approach. Acupuncture for Our Seniors Act is something that was Judy Chu in California had submitted, but there's not a whole lot of traction for that, but I appreciate her efforts. And you can see, again, the ones in red are things that I included after our revision, so that there's nothing special about the ones in red. I just, I was too lazy to get rid of the red while I was putting this together. And the Joint Commission pain management standard came out, and everyone in hospital systems knows about the Joint Commission, and they said we should have the first tier approach in both chronic and acute pain as being non-pharmacologic, like acupuncture. But hospital systems say, okay, and they do other non-pharmacologic approaches. Now think about it. Surgery is a non-pharmacologic approach. So when we write things and then we get the result, we go, wait, that's not what we intended for. So it's kind of funny, but that's the end of my presentation, and I truly appreciate your time. And Cheryl, you have a comment or
yeah, this is so interesting. It's just fascinating. But one last question. I noticed all of those phenomenal articles, but they had a tendency to focus on experimentation quantitative. Are there articles out there that you can refer us to that focus more on, in alignment with Robin talk about qualitative and the lived experience phenomenology? Because there's nothing as powerful as what Robin was saying, how she's referring friends and others to the center that she's going to because of her experience and the positive experience that she experienced with acupuncture. But it seemed like those type of qualitative lived experiences, you don't see many of those. Everything is at what the evidence says and all of that, randomized controlled trials and all of that. But what about qualitative, the lived experience of patients who actually have undergone acupuncture? Are there articles out there? I'm sure they are. I just don't know where they are. I hadn't read one yet.
No, it's a great question. I presented at the Society of Acupuncture Research Symposium in New York this past spring. And one of the things we were talking about is training acupuncturists to do more case studies. Because case studies are something that both in nursing and in medicine, they say, hey, it's a lower tier. It's definitely not a randomized controlled trial or a literature review or a meta-analysis, but it certainly offers information. And so there are quite a few of those, but once again, because acupuncturists aren't terribly trained in that, we're not seeing as many. I trained under Dr. Li-Xing Lao, who is extremely well known. At the time that I was studying under him, he had 160 publications to his name. And I approached him and said, when I grow up, I want to be just like you. And so I ended up following in his footsteps. But most of his stuff is NIH, big money, real
big money,
research.
exactly.
So, no offense to me, but I'm not a PI. I'm not
I hear you. Yeah. So going back, it's all driven by the dollars. We understand. But Robin,
Yes.
you have a powerful story. You can write your own story and submit your own abstract. I tell you. Okay, let me take my hand down. I'm finished.
Okay, well, I would like to end then with a wonderful, you saw the wonderful, I'm sorry, Lauren, did you want to say something?
No, no,
Oh.
I got booted off before.
Oh, okay. So what I want to end with was one of the slides that Bill showed was the 5 elements, and I'd like to do a 5-element meditation. So if you want to, you can place your hands on your heart, because this is the fire element, and it is the in your organ, and also the yang organ is our small intestine. And the emotions that go with that, of course, are joy and sorrow. So breathe in the color red and color your heart top to bottom, inside and out, front and back with the color red. Breathing in joy and letting go of a sorrow. And next, move down to your stomach area, which is the yang organ, and your spleen is the in your organ. And the emotions are serenity and anxiety. So breathe in the color yellow and color your stomach top to bottom, inside and out, front and back with the color yellow. And breathe in serenity. Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And let go of something that makes you anxious. And then come up to your lungs. This is the metal element. This spleen and the stomach, of course, were the earth element. So your lung is the in organ, and your yang organ is your large intestine. And the emotions with that are grief and happiness. So breathe in the color white and color your lungs top to bottom, inside and out, front and back with the color white. Breathing in what makes you happy and letting go of a grief. And our next element is the water element, and that's your urinary bladder and your kidneys. So of course the kidneys are the in organ, and our urinary bladder is the yang organ. And so breathe in the color blue. The emotions with this are courage and fear. So breathe in the color blue and color your urinary bladder top to bottom, inside and out, front and back with the color blue. Breathing in courage and letting go of a fear. And our last element is the wood element, which is our liver and our gallbladder. And of course, that's in our lower right rib cage. And of course, it deals with anger and peace. So breathe in color green and color, even if your gallbladder has been removed, its energy is still there. So breathe in the color green and color your gallbladder top to bottom, inside and out, front and back with the color green. Breathing in peace and letting go of anger. And we've come full circle to our fire element, back to our heart. And of course, as Caritas believers and manifesting this on Mother Earth, we send our heart out to the community and to ourselves. So thank you. Have a good day. Namaste, namaskar. And thank you, Bill, for your presentation and spending the extra time with us.
Thank you, everybody.
It's my absolute pleasure. Thanks for having me.
Have a wonderful day.
Yes. And a happy St. Patty's Day, everybody. Happy St.
Yes.
Patty's Day.
Thank you, Bill, for your
Even if you-
wonderful
even if you're not-
presentation.
Bye-bye.
Thank you so
Thank
much.
you.
Powerful presentation. Thank
Oh,
you.
it's my
Yeah.
pleasure.
We
You
must
bet.
have Bill back again. That was
Yeah.
so informative.
I'd be happy to do that.
Thank
Okay,
you.
thank
Thank
you all.
you.
Enjoy the rest
All right.
of your weekend.
Thank you, Bill. Thank
Bye,
you.
everybody.
Thank you,
Bye-bye.
Carol.
Bye-bye.
Bye-bye.
Bye.
Bye-bye.